everybody, it's Wednesday, time for Wisdom Wednesday. I was listening to a podcast this week with Dr. David Perlmutter, who wrote Grain Brain and several other books, and just was thinking about what it is that we need to be thinking about as far as really trying to help preserve our brain function. You know, I tell everybody I just don't want to outlive my brain. And the reality is, if you live to be 85, you have a 50-50 chance of having some neurodegenerative changes, and it's worrisome. I mean, that's 50-50. That's 1 out of 2. And, you know, we just don't want to leave our children with that type of trial to have to deal with is a parent with a brain neurodegenerative disorder. And these, just like diabetes, it doesn't just start one day you're diabetic. There is a continuum, and the reality is that you can actually start today and try to do a few things that really put yourself in a position to have significantly less risk for a neurodegenerative chronic illness, such as Alzheimer's or vascular dementia or Parkinson's. Any of these that can really be bundled together. And what we know an awful lot about this is it really has to do, a significant amount of it has to do with lifestyle. Now, there are some genetic components, no doubt. And the lifestyle things we've talked about over and over and kind of ad nauseum do come into play as far as diet and nutrition and exercise and sleep and stress management, all of those things. And of course, a hormone program, which we are very favorably inclined to support, obviously, in our practice. But even without that, you know, what are you doing to try to decrease your risk for overall brain complications and aging and degenerative type changes? And he talked initially, Dr. Perlmutter, in this podcast about just the 4 things you can look at just without even really having to do much investigation, such as an MRI or CT scan or any of those things. But just look at, first of all, your waist circumference. We know that increased waist circumference can be a real problem for a lot of folks in terms of knowing that there are issues with insulin resistance and visceral fat. And it is that visceral fat that has actually glandular activity and interconnectivity in a negative way as far as inflammation in the body, and getting rid of that is huge as far as your overall health and wellness. So getting your waist circumference. Now, just to let us know, a waist circumference for men, low risk is 37 inches or less is low risk. Between 37 and 40 is considered high risk, and over 40 inches is very high risk. For women, low risk is 31.5 inches or less, and 31.5 to 34.6 is high risk, and anything above 34.6 is considered very high risk. So there is some data just with waist circumference alone and in terms of consideration for visceral fat. Now, we know that there are going to be exceptions for people who tend to be a little bit thicker but not necessarily have a significant amount of visceral fat. The other things that are important are blood sugar, fasting blood sugar, blood pressure, and really how much activity you're doing overall. And you can reduce your risk by 70% by getting these things in alignment and getting yourself into low risk categories. But again, remember, this happens 20, 30 years before anyone ever really begins to see significant decline in memory or even just mild cognitive impairment. So being mindful of those things, I think that just on your own, you can just check your waist circumference. You can evaluate your blood sugar with your yearly checkups, your blood pressure. Keeping those things all in alignment are very, very helpful. Now, what other things can you do? Well, we know that you can optimize your sleep. You can reduce sugar and intake into your body. We know that insulin resistance plays a huge role in Alzheimer's. In particular, many people believe that this is type 3 diabetes, meaning that it is a diabetic, something that's happening within the brain. We know that sleep is absolutely important for reducing your risk, and that alone has a significant impact on whether or not you can develop any type of neurodegenerative change. And these things often start very early on. So optimizing sleep, doing your exercise, eating well, no smoking, reducing stress. We know that supplements, in particular DHA, which is found in omega-3 fish oil, increasing levels can be associated with decreasing decline as far as cognition is concerned. And we know that one of the things that's important about DHA and fish oil is that it is part of the cellular membranes of our brain cells. So getting enough DHEA can be very powerful. The EHA is a little more important for heart. So we have these two types of fatty acids in the omega-3, the DHA and EPA, and DHA tends to be more for brain and EPA for heart. But getting enough of that is really important. It also reduces inflammation in the body, which can be very helpful for overall brain health. And what happens at night? We know that melatonin has been shown to reduce our risk for Alzheimer's up to 30% when we even take exogenous melatonin, and we've talked about that on other talks as well. So I would just like to get you thinking about what it is that you want to do to preserve your brain health and getting that a little into focus, not just knowing that you have a low cholesterol, not just that you have a low blood sugar, but getting those things and getting your body into a better position too. And we're seeing such great results with our weight loss program, and getting that middle section, burning off a lot of that visceral fat can be exceedingly helpful as well. But just wanted to bring it to your attention that these things start early. They don't just happen overnight. Mama didn't just lose her memory overnight. It's over a long period of time. So as we age, just know that we have a role in trying to help prevent cognitive decline and neurodegenerative changes in our brain. We have some control over that. Hopefully that's been helpful for you. I hope you guys have a great week, and we'll talk again next week.